What does rehab in Ghana look like? What's the general healthcare system?
Okay, so in Ghana, we are lucky to have like quite a number of medical specialties. In fact, it's really growing very well, but rehab is not that as advanced as the other medical specialties. So we have OBGYN surgery, all the others, but PM&R is something very new. In fact, it's one of the, I think it's still the newest like specialty. In Ghana, we have almost the whole country, less than 700 physical therapists, somewhere around 100 or so occupational therapists, about 46 or 7 speech therapists, very few orthotists, prosthetists. The number is growing though, because recently, like over the past couple of years, the government has established more training institutions for these specialties. But for PM&R, I'm the only person. Luckily, we have 8 more doctors in training who are interested in training, which is a huge, like, I'm so excited about that. But then what it means is that if somebody has a spinal cord injury, if somebody has a stroke, a traumatic brain injury, a child is born, has autism, has cerebral palsy, the service in itself is not there because we don't even have the numbers to advocate for these services.
What's the population?
So the population of Ghana is 38 million. So
Wow.
one PM&R physician for a population of 38 million. And like I heard, Mary Freebird in total across the country has more rehab professionals than the whole of Ghana. And so that's how it is like. So somebody gets, for example, the hospital I used to work in is like the second largest teaching hospital, which has an acute stroke unit. Mm-hmm. But the stroke unit has very few beds, around 10 or so or less. And what happens is that you have, at the time I was working there, you have a maximum stay of 14 days, max 15 days.
Regardless of what condition you have.
And you have to be out, either to a general ward or sent home. And what was happening is that there wasn't really any rehab physician to start that discussion on right from day one. You know how we're trained to start discussing discharge planning, send someone to the house to assess the home, make it disability friendly, set it up so family can. So family comes one day and they are told, your family member has been discharged. You need to make the payment, pay the bills, and take him or her home. And they are like, we thought by the time they were leaving the acute stroke unit, they would be walking. But this is someone who probably has an NG tube, has a catheter in there and cannot walk, barely maybe cannot talk, has aphasia, and you have to take this patient home. Maybe they are renting an apartment, they live on the second floor. How are they going to take this patient home? How are they going to care for this patient? Again, in terms of support services, so when I started, I used to write a lot of letters to the district assembly to see if we could get some funding, to get some assistive devices, to get them to continue rehab on outpatient basis, because we have no inpatient rehab facility in Ghana, none at all. What we have on outpatient is a bit of PT, physical therapy, occupational therapy, speech therapy, orthotics and prosthetics, and then I have my PM&R clinic, all on outpatient basis.